Hi, this is Rebecca Hergert. Today we're going to talk about a hot topic. We're going to talk about pressure ulcer care. Pressure ulcer is caused by a tissue being squeezed between two hard surfaces. One surface is usually a bone, and the other surface is the surface that they're laying on. The tissue in between doesn't get enough blood flow and kind of dies of oxygen starvation. You can also create a pressure ulcer when there's shear, when you pull them up in the bed and that tissue is just kind of rubbed off. It's a combination of shear and friction that causes those. Pressure ulcer are inaccurately called, but you also often hear them called decubitus ulcers or pressure sores or bed sores. But they're really pressure ulcers because that's what's causing them is the pressure. Pressure ulcers can occur anywhere on the body where you have a bony prominence meeting a hard surface. It can be on the sacrum. If they're sitting up in a chair, it can be on the shoulder blades. It can be on the shoulders. It can be on the elbows. It can be on the hips. It can be on the ankles. It can be on the heels. So look for where the rubber meets the road, okay? Wherever the body is meeting a surface, and especially if there's a bone there, watch out for pressure ulcers. They can also happen with non-bony areas that are in constant contact with the surface tissue. The way that we're dealing with pressure ulcers now is we perform and repeat risk assessments every shift. You decide which patients are at risk and what you need to be doing to mitigate that risk. So what makes a patient at risk? Well, patients who are not able to move by themselves, patients who are not alert, not oriented, patients who are in a lot of pain and don't want to move because it hurts to move. Patients who are confused, patients who are medicated to where they're sleepy. These are all patients who are at risk. If they're not eating well, if they're dehydrated, if they're malnourished, they will be more at risk for skin breakdown. If their skin is dry, if it's brittle, they're more likely to have a decubitus ulcer. So you want to look and assess all risk factors. Use your risk scores to plan your care. Does your patient need to be reminded to turn every couple hours, or do you need to come in and turn them every 2 hours? Are they really fragile? Do you need to move it to every 1 hour? Because you may. Ongoing skin assessments can help detect early signs of pressure damage. Usually the earliest sign is just a reddened area that doesn't blanch. Routinely assess patients for individual risks of pressure ulcers. Assess and inspect their skin daily. That's why doing the bath yourself is a really good thing if you can. If they're not capable, if there's any hesitation, if there's any doubt in your mind whether or not they're able to turn a position well, you probably need to be doing that bath so that you can assess every inch of their skin. And you do want to document your results. Make sure that you redistribute the amount and duration of pressure in order to prevent ischemic injury. You want to turn and position them often, at least every 2 hours. Sometimes you'll need to do more so. You need to get them off of those superficial capillaries in order to make sure that you're not stopping blood flow, or that the pressure is not stopping blood flow. A lot of beds are specialized. They're fluidized, so they've got like little beads in them, and they're not on any one certain surface for any amount of time because the bed is just constantly, some blow up and let down, some have got little beads in them that are just constantly moving. They also have mattress overlays that are air mattress that will help reduce the amount of pressure that the patient has against their body, so they can try to cut back a little bit on the ischemia. If anyone is incontinent of stool or urine, you want to make sure that you change them as quickly as you can because those have very corrosive elements in them that can greatly increase how quickly their skin breaks down. You want to minimize friction and shear. You don't want to just pull them up in bed. You want to lift them up and then move them up. So don't try to pull somebody up by yourself. You're more likely to cause shear injury. Get somebody to help you lift them up and move them up if they can't move themselves. And watch their nutritional status. See what they're eating. See how much they're drinking. Because if they're undernourished, their body is going to begin to take nutrition from their muscle and fat layers anyway. I've got a quick quiz on the PowerPoint, so I want you to pause it, look at that, think about it, and see what answer you come up with. Add it as part of your ticket in.